Good morning, good afternoon, good evening, depending on where you're in the world. It's an absolute pleasure for me to be here with you today at the 7th live session from the Healthcare Transformer. My name is Cristina Barreca. I'm a global head of customer experience, and I'm super excited to be here with you today because it's really about talking about putting the patients at the center. So thank you for joining the live event today. Just to be more specific, we're going to talk about how we move the care from the hospital setting to the home setting. More people than ever before are really receiving medical care into their home as we have new technology, telemedicine, patients monitoring devices that makes it much easier. For me, this is super exciting because this is a shift in the way of how we do care. But it's not only improving patient experience, but also generating value for caregiver, physicians, tech companies, and investors. Today, we have a super exciting speaker with us. Her name is Robin Farmanfarmaian. So it's an absolute pleasure for me to welcome Robin here today with us. So Robin is a professional speaker, entrepreneur, and angel investors. We're really lucky to have her here. So before I hand it over to Robin, I just wanted to say today is really about listening to Robin and her inspiring talk, but it's also about us connecting live and having a very healthy Q&A afterwards. So please, during the course of the talk, make sure that you post your questions. And then also what you can do is to upvote questions, so you increase the likelihood of the question being answered. Now, if we cannot get all the questions, no, not to worry. We will do our best to answer your questions offline, and we will post them on our platform in one of our next publications. So without further ado, Robin, I would like to pass it over to you. The stage is yours.
Thank you. I am so incredibly excited to be here. And so you can read my bio. I'm an early stage entrepreneur, across pharmaceuticals, medical device, and AI-based software. But I want to tell you a little bit more about my point of view. You see, I'm not just an entrepreneur. I'm also a severe chronic disease patient. At the age of 16, I was misdiagnosed with an autoimmune disease, ended up resulting in 43 hospitalizations, 6 major surgeries, and 3 organs removed. Now, by the time I was 26, this was 7 years after I'd had my entire large intestine surgically removed. For the GI experts, it was a total colectomy with J-pouch, which was considered a cure. But I definitely wasn't cured, and I was in pretty extreme pain. So over a period of time, my doctors just kept upping and upping my opiate dose until eventually they switched me over to 80 milligrams a day of methadone. Now, that is an absolutely gigantic dose of medication, and I hated it. And so as soon as I could get back into my doctor, I said, hey, doc, I want to get off this medication. I think the rebound pain is worse than the original pain. And she said, okay, well, next step could be to surgically implant a morphine pump into your spine. Like, are you kidding? I was 26 years old. I was essentially a shut-in. I could barely function on a daily basis. And what I was hearing was that was the rest of my life. And so I said, absolutely not. And I fired my entire healthcare team. Went home that night and I dropped my own methadone dose by about 40%, which I would never recommend anybody do. But I'm one of those, massively overdriven type A personalities. And I wanted to get a big jump start on a taper, right? And so I went through about a week of pretty hardcore opioid withdrawal, where all I could do was crawl from my bedroom into the kitchen just to get lemonade and salt, because that was the only thing I could get down all week. But then I felt better, and I rebuilt my care team with doctors that worked with me as a team and a colleague. I ended up getting diagnosed correctly with Crohn's disease, put on an IV medication called Remicade, and within 24 hours of that very first dose, I went into full remission. It literally happened overnight. And so that's why I do what I do. And that's why I also want to say a huge thank you to everyone joining today, and especially to Roche, because really at the end of the day, pharmaceuticals and medical devices are what really help save patient lives. And so I'm really, really grateful for companies like Roche. All right, so now that I've shocked everyone, let's talk about some of the trends and the technologies shifting care into the patient's home. So across governments and industries, those who control the flow of money definitely control a lot of the power. And here in the United States, that is the giant payers. Companies like United, CVS Aetna, and Humana are three of our giant payers. And together, over the past 2 years, they have collectively spent over 40 billion, with a B, billion dollars acquiring companies that shift care into the patient's home, specifically for the Medicare population around value-based healthcare. Now, even for these giants, over $40 billion is definitely a massive amount of money. And the fact that all of them are doing it at the same time means this is something we really need to pay attention to. Then looking at companies like Amazon, if you think back to Amazon when they bought Whole Foods, right? One giant check, and all of a sudden they had a very robust supermarket chain across all of the United States. Well, they're using that same exact playbook, but in healthcare. Earlier this year, they spent $3.9 billion to acquire a company called One Medical. One Medical is actually where I have one of my doctors. It's primary care for everyone from birth to death, right? And they have over 180 brick and mortar clinics around the country. And all of those have blood labs in them. And they have about 8,000 clinicians and over 830,000 patients. With one giant check, all of a sudden, Amazon became a full-on provider. And not just that, but I've had my care at One Medical now for about 7 years, which means all of my medical tests, all of my imaging tests, all of my medications, hospital notes, doctor notes, all get sent to my primary care doctor, which is now owned by Amazon. Something to think about. Now, if you remember about 2 years ago, Amazon bought a company called PillPack for $750 million. PillPack, it's a great company. What it is it comes to you in the mail, your medications in little tiny packets that have the date and the time stamped on them. So you know which medications to take when, and then you have proof that you've taken them. It's a really big deal for patients who are aging in place, because one of the reasons a lot of people have to go into assisted living is because keeping track of the medications is too hard. So definitely a fantastic company. But I think the main reason Amazon bought PillPack is because overnight, with one giant check, they now have pharmacy licenses in all 50 states. It's a really big deal. Now they've launched things like transparent pricing in their pharmacy and a $5 a month subscription model for all the medications, generic medications that is, you could possibly need. Now, lastly, they are also working on remote patient monitoring and working to scale that using Amazon Web Services. And that'll make a little bit more sense in just a couple of minutes. Now, I am guessing 90% of the people watching right now have some type of a wearable tech device, right? Whether that's the Apple Watch or if that's a Fitbit, most of us understand what these things are. That's a really big deal because biometric monitoring has gone mainstream. Now, as a patient, if I go into my doctor, it's no longer something new and scary, right? And that's a big deal when you're a chronic disease patient or say newly diagnosed or just overwhelmed and you have just too much going on at once. Learning something brand new can be a big barrier, right? But because we already are all familiar with things like the Apple Watch, this is now a much easier sell for the doctor. And so the doctor can say, hey, Robin, we want to use your Apple Watch to do remote patient monitoring on you. That's an easy sell. Now, the Apple Watch has a single lead EKG on it, but expect over the next 5 years for them to become much more multifunctional. And in fact, we are seeing a lot of wearable tech devices either do a single lead EKG or use something called PPG technology. That stands for photoplasmography. And that's how pulse oximeters have worked now for over 40 years. In fact, both the single lead EKG and the PPG technology is literally decades old. Old technology, but new applications. Now, of course, the Apple Watch is also a platform, which means companies can build apps on the Apple Watch. And so AmerisourceBergen, it's a giant company here in the United States. They just renamed themselves Cencora. Well, they have an Apple Watch app that is available by prescription only, right? And what it does is it taps into the gyroscope and the accelerometer to translate Parkinson's disease symptoms, specifically things like involuntary body movements and spasms. For the first time ever, we can objectively measure somebody's Parkinson's disease and those involuntary movements over a period of time versus subjectively, which is what we've been doing all this time. Now, we're seeing a lot of companies go beyond just like the wearable bracelets and the watches into patches that can fit on a patient's chest. And so one called Vital Connect, it's a single lead EKG used in the hospital and sent home with the patient, wireless 24-hour disposable patch. It's about right here and it's only about this big. Now, they have done a study and they are able to predict with 80% accuracy a cardiac readmission with over 6 days advance notice, right? And we're early in this kind of technology. Now, BioIntelliSense, they also have a patch that sits here and it's able to sit there for about 2 weeks. And it also has a single lead EKG. They are taking over 1,400 measurements every single day on every single patient. But BioBeat, it's a little bit bigger. It's about this big, and it's a 5-day battery. Now they are using PPG technology, and through that, they're able to continuously monitor 13 different vital signs, including continuous blood pressure monitoring. Now that means they are taking millions of data points every single day on every single patient. Makes a lot of sense why Amazon wants to scale remote patient monitoring using Amazon Web Services. Now, beyond the wearable tech and these devices that fit onto a patient's body, we're seeing a lot of different tools going into the home. And so one I like to talk about is TytoCare. So if you haven't heard of TytoCare, this is a TytoCare. It is a small video camera, and then it has medical device applicators. Here is an otoscope applicator, a tongue depressor to look down the throat, and here's the stethoscope. And so all I do is I take this video camera, the stethoscope, and click it into the back. All of a sudden, this is an actual stethoscope. And so if I'm not feeling well, or, and I don't want to go to a clinic or say urgent care, I can call a doctor over video through an app on my phone, and then she can hook into seeing this live video camera feed. And so I can put it on my chest so she can hear heart and lung sounds. Now, they already have AI-based software that are helping with those heart and lung sounds to be clearer and to help interpret them both for the doctor and the physician and the patient. And here's the otoscope, which is really cool. All of a sudden, that can go down and the doctor can see down the throat. By the way, they launched out of Best Buy about 2 or 3 years ago, and they are already distributed in places like schools, coliseums, right? Places where you have a lot of people potentially, but you don't have a doctor or a nurse hanging around. Now, we're also seeing sensors going on to any existing inhaler, specifically for things like asthma and COPD. Now, what these sensors are doing is they're measuring when, where, how often, and how much medication somebody is taking. Now, just by adding that sensor and a digital therapeutic app, which works in conjunction with the sensor on an inhaler, a company called Propeller, they're one of the oldest in the space. They're about 10 years old now. They are already seeing a 58% increase in medication adherence and a 78% reduction in a rescue inhaler around asthma. Those are giant numbers. Now, because things like microphones have become absolutely ubiquitous, right? Whether you've got a smart speaker or say your smartphone or your tablet, well, we can start to think about recording absolutely new vital signs that we've never thought about before. And so there's one company that I really like called Hyphe, Hyphe, and they are counting the number of times someone coughs on a daily basis. Think about that for a second. Coughing is one of the main symptoms that drives patients into a clinic or into urgent care. But the problem is, imagine I had a chronic cough and I go into the doctor who would switch me on to a new medication. And the doctor could say things like, hey, Robin, how's that new medication working? I think it's good, doc. Well, how many times do you think you coughed yesterday? 5,203? Like, we have no idea how many times a day we cough. And by the way, the time of day when somebody is coughing, whether they're sleeping or they're awake, also is a big deal to understand for a physician. And so just counting the number of times someone coughs on a daily basis is great for things like disease trajectory or medication efficacy. But HIFE even takes it one step further, and they are able to categorize coughs into things like a whooping cough or a wheezing cough or a productive cough, because the way a cough sounds is both an indication of what is wrong, but of what treatment might work for that individual. Now, they are looking at things like COPD, which of course is incredibly difficult for patients to manage. And just by monitoring coughs, they are able to predict 3 days in advance of when a COPD patient would go and get help from a clinic or an emergency room. It's a really big deal. Now, I get the vast majority of my healthcare in my apartment or within, say, a 2-block radius, because proximity matters, right? Well, we're seeing a lot of services going into the home. And I get now my IV medication, Remicade, in the home. In fact, I've been on it for a little over 20 years. And for the first 15 years or so, I got it done in hospitals. And I'd walk in and, I love my hospitals. I love my specialists especially, right? But the infusion clinic left a lot to be desired. I'd walk in and it would be this giant room with 15 other patients all getting IV medication. And there would be televisions blaring, overhead announcements. And when you've got 16 patients all in a room getting IVs, there's always 1 or 2 IV alarms that are going off. And they go off for 3 to 4 minutes at a lot of time, which means for hours at a time, all I was hearing was these high-pitched beeps. And so I would go home and my body would hurt from head to toe, right? Every single cell in my body would hurt. And it would take me about a week to recover. Well, I worked in pharmaceuticals. While I'm not on the science side, I do understand the basics. And so Remicade is the granddaddy, the first of the anti-TNF alpha drugs, tumor necrosis factor. And it's a biologic, which means it's dealing with proteins, and not just human protein, but Remicade has mouse protein in it. And so in my head, it seemed absolutely logical that I would be getting, pretty hardcore side effects to an IV medication. About 7 years ago, I want to say, my insurance company came to me and said, hey, Robin, you want to stay on Remicade? You're going to have to get it done in the home. Like, you're just telling me this now? I would have been doing it in the home the entire time. And so the way it works is my GI doctor just sends orders to a full service pharmacy. I happen to use a company called Option Care. It's one of the giants. It covers all of the United States. It used to be Walgreens Infusion. Now it's owned by private equity. And they ship the medication to me on ice using FedEx. And then I just throw it in my refrigerator. And they deploy a nurse to my home the next week to mix the medication on site and then administer it over a period of time. My recovery time went from a pretty hardcore 7 or 8 days to a mild to non-existent 0 to 2 days, just by changing the patient environment. I wasn't reacting to the medication. I was reacting to getting that medication in an incredibly toxic environment. Because think about it, I'm immunosuppressed, and anytime someone who is immunosuppressed walks into a hospital, they're surrounded by infectious disease. In fact, it might have been the noise, but it also could have been the fact that maybe I was fighting something off a lot of the time when I went into the infusion clinic, because the patient who walks into the hospital right behind me may have some type of a communicable disease. Now, of course, the insurance companies weren't thinking about the fact that I'd have less side effects in the home. They're doing it because of cost. Now, it turns out the infusion clinic was charging $28,000 just for the medication, and I get this 8 times a year. Option Care, they charge $2,500. Over a period of 5 years, that comes out to a difference in billing of over $1 million. This is a medication that most patients are on for life. Now, let's take this one step further. A couple of years before the pandemic, I got one of those, 24-hour GI flus. Pretty uncomfortable few days for a normal patient, but when you have Crohn's disease and no large intestine, it is life-threatening and within hours. Went to bed on a Friday night and I was like, something feels a little off. By Saturday morning at 7 a.m., I knew if I didn't get IV saline and IV magnesium, I was probably going to die. But the problem was I was already so depleted, I couldn't get to an emergency room. So I was going to have to call an ambulance. Every way you look at that, it is a horrific use of medical resources. All I needed was a nurse their first day at a nursing school to come give me IV saline and IV magnesium. I didn't need the type of care you can get with an ambulance and then an emergency room. So instead, I used a company called IV Doc. It is one of the many, many, many direct-to-consumer IV hydration companies that have sprung up across the United States in the past 10 years or so. I went on an app and I just ordered 2 liters of saline and 400 megs of magnesium. This doesn't go through my doctor, but they do have a doctor on staff. He saw what I had ordered and got worried and called me immediately. And we had a telemedicine visit. And he's like, okay, what's going on? Why did you order 2 liters? I explained the situation and he expedited a nurse to my home. In under an hour, they were already there giving me IV saline and IV magnesium. And I did that for Saturday and Sunday. And then Monday and Tuesday, my GI doctor was able to have Option Care come in, give me more saline, more magnesium, and even draw some labs, and then just drop them off at the nearest LabCorp or Quest. I was able to avoid an ambulance ride, an ER visit, and even a potential multi-day hospitalization by kind of hacking it together. And while this is great for patients like myself, typically companies like IV Doc, their biggest customer base are actually people with hangovers. Now, I recognize that not everyone is going to want to try and order things on themselves, right? Like I'm kind of a patient of a different color, but we're seeing the industry go this way. And so Medicare, and in this country, we look to Medicare to really set the standard of care. They launched a program called the ET3, Emergency Triage Program, about 3.5 years ago. It's a voluntary 5-year payment model that provides in-home urgent care. So the way it works is they send an ambulance to the home with either a physician's assistant or a nurse practitioner. And if they're able to take care of the patient in place, they do, right? And so had I been a Medicare patient, absolutely, they could have easily taken care of me in place. If the patient needs to see a doctor, they do it right then and there over video while the nurse is holding the patient's hand. And only then, if they still have not been able to take care of the patient in place, do they transport them, but not directly to the emergency room anymore. First, they think about things like primary care, dialysis, urgent care, or even mental health facilities, and only use the emergency room as a last resort. Now, there's a company called Dispatch Health that I like to talk about. This is at-home urgent care, at-home remote patient monitoring, dialysis, and the hospital at home. Now, the reason I keep an eye on Dispatch Health is because they have an over $1.5 billion valuation, and they have hundreds of millions of dollars of funding. The 2 of their giant funders, United Healthcare and Humana, 2 of our giant private payers. When 2 of those companies put money into the same exact startup, I like to pay attention. Now, before we start into the Q&A section, I want to give you 3 takeaways, right? First and foremost, this is scary, right? Like I'm a chronic disease patient. It's scary sometimes to move things into the home. And we're seeing, physicians and other providers are also a little bit scared. But let me tell you a little story. One of my nurses is seeing across, the Crohn's community, everyone's pretty much been forced into the home. to do their Remicade. She said she had a patient who was getting so many side effects in the hospital infusion clinic that they would actually slow the medication down. And so the patient would get it over, say, 4 or 5 hours in the infusion clinic. And they were terrified, absolutely terrified, when their insurance company said, you've got to do this in the home. We aren't paying for it anymore in a hospital infusion clinic. And same exact thing happened to him that happened to me. First time they got Remicade in the home, all of their side effects went away, right? Second takeaway, the patient as the CEO. In fact, I embody that, obviously. And my first book is called The Patient as CEO, came out about 8 years ago. And just like the CEO of a corporation, you're not necessarily an expert in marketing, finance, legal. As the CEO of a corporation, you surround yourself with experts who do their job, report back to you. But as the CEO, it is your ultimate responsibility to make sure that vision is carried out and that the company is successful. So I say, why should being a patient be any different, right? Be the CEO of your own healthcare team. You bring on the experts, but in the end of the day, it is the responsibility of the patient to be able to make sure that they're actually getting their healthcare. And lastly, artificial intelligence and the shift in care to the patient's home really helps democratize healthcare on a level that we've never been able to see before. With that, I'm going to shoot it back over to Cristina for some Q&A.
Hey, Robin, thank you so much, first of all, for really sharing your personal story, very powerful, and then also from introducing some of the tech giants and the technology around there. So I can see that the Q&A tool is getting busy. If you haven't posted already, please post the questions in the Q&A tool and you can upvote. And I'm going to try, actually, when I read a question out, to also use people's names, because I feel we are in a group of people that we're all about learning. I do apologize if I don't pronounce all the name on the webinar exactly in the same way. So we have the first question from Martin. Martin's question is, audiology is ready to make transition from hospital and conventional clinics into the comforts of clients' own home. Do you believe there might be a market for audiologists to assist with various wearables?
Oh, absolutely. I mean, just thinking about things like the counting of the coughs, but we are seeing a lot of other companies getting into what's called let's see. Oh, there's one of the CMOs of Hive has a really cool name that he calls himself, but essentially using a patient's voice as a vital sign, and not just things like coughing, but being able to understand if they're getting into a mental health problem or if they are getting a virus over time. And then for the hearing themselves, of course, like, I mean, you see, I'm wearing the, AirPods. These are getting better and better and better. And so we're going to be able to start measuring more things through the patient's ears as well, including things like how well they are hearing. So absolutely, there's a huge market for both listening and diagnostics.
Fantastic. And so, and now to broaden a little bit the scope, we have a question from Simone. How willing do you think healthcare professionals are to provide care at home? And what is needed from healthcare organization to help make them more comfortable or accepting of this?
So it's going to depend on the physician or the provider, right? Some of the younger generation that are just graduating from medical school now, they're probably more open to it because they grew up with technology, right? And so they're used to being able to do these big leaps in how technology works. And then maybe someone is, in their 60s or 70s and still practicing, and this is a little bit more foreign to them. And so absolutely, it depends on the provider. But there is a part that we don't think about a lot. And I actually had to move my care from one hospital system to another because they didn't want to prescribe Remicade in the home. And so my providers were told at that particular hospital chain, nope, we keep all IV infusion clinic patients in our infusion clinic. We refuse to allow it to be outside of it. And because my insurance wouldn't pay the $28,000 they wanted to charge, I was forced to change hospital chains in order to be able to get my Remicade in the home. And so, yes, we're going to go up against certain doctors that might not want to do it, some that might want to do it. And then, of course, at the end of the day, these hospitals and health systems are thinking about their revenue, right? Because they've got to stay in business. And so that's one of the reasons they might not want to shift into the patient's home.
Fantastic. Robin, I love what you said, which is really about patient empowerment, right? It's about patient now even have the choice to literally decide, do I change my doctor, right? I think in the past, maybe we were very dedicated to the center very close to home, and now we are really, I would say, to shop around a little bit more. And this is also putting some pressure in the different healthcare providers. So I think it's very healthy. Okay, let's try to grab another question. I can see that popping up very fast, so that's fantastic. So the question is, as someone who has made the switch themselves, what are the key learnings and what would you say to patients considering the switch?
Do some research, right? Because like my hospital chains never ever told me that I could get Remicade in the home. They never told me that I could do telemedicine visits, right? These are things that kind of either came from my insurance company or came because I had a problem and I needed to find a new solution. So I would say do your research. And one of the best resources are other patients. And so companies like Facebook has a page for every single disease out there, and it's patient run. And so a lot of the time I'll go onto those message boards, those Facebook pages, and I'll interact with other patients who have Crohn's disease to really get some not only learnings, but some advice. And I go on those to give advice to other Crohn's patients all the time as well.
Brilliant. Thank you again about really patients empowerment, right? So talk to other patients and really understand their feedback. Now we have more of a, I would say, technical questions. So it's about from Dennis. Which databases and platform for remote care do you find to be the most advanced?
So there's a lot going on in the companies who want to be that platform that can shift care into the home, whether that's the dialysis, IV medication, or the full-on hospital at home. And so there's two companies I like to keep an eye on. One is called Current Health. Now, Current Health was started in 2015, and I think it was 2021, they were acquired by Best Buy, the consumer electronics giant. So Best Buy now for $400 million, all of a sudden is a hospital provider. And they have been kind of going all into things like the connected care and aging in place. But with this acquisition, they now provide the hospitalizations at home. Another company that I like is Bioformith. Now, Bioformith does the same kind of thing that Current Health does, and they even send in nurses and things like that so they can staff it as well. But the other reason I really like Bioformith is because it not just does the hospital at home, but it does clinical trials at home. And about 85% of clinical trials are significantly delayed purely due to patient enrollment. And so Bioformith now takes clinical trials and makes them accessible to everyone in the country, regardless of where they live. And that's a really big deal.
Yeah, it's about really ensuring access independently of where you are. Fantastic. So I am loving one question that just popped up from Danica. So it's really about breaking the barriers. And so the question is about there's so many barriers within the healthcare system, how care is paid, the willingness of providers to support care at home, also how patients are supported. And so the question is about how do we as patients engage the leaders who can affect who can push the change needed to get more care at home. So what can we do as patients to push this barrier even further?
Demand it, right? Like, just like I had to move hospital chains to get my Remicade in home, that's what you've got to do, right? So you have to go to the providers with the ideas that you want. And if they refuse to do it for whatever reason, then you have to go find another provider. Right? Like you are not stuck with one doctor anymore. It used to feel like that, but now you have options.
Very good. Again, as we said before, right? Patients empowerment and really shop around for our health. The same as we do with our grocery shopping, also only more important because it's about our own health. So if we, now there is a question about a remote blood diagnostic. So we have, what do you think about a remote blood diagnostic device able to monitor the day-to-day change in thrombosis risk and guiding precision antithrombotic treatment. Will this reduce the current burden healthcare system by cardiovascular diseases?
So there is a lot going on specifically in monitoring cardiovascular disease. And that's why we're seeing so many of these patches that stick to a patient's chest for anywhere from 24 hours to 2 weeks at a time. And so being able to catch, like, say, some type of a heart exacerbation, even 3 days in advance, is a really big deal. But beyond the diagnostics I talked about today, we're seeing a lot of other tests going into the home. And so here's one that I'm dropping on the floor. This is, gotta hold it this way. This is a urine test that you can have in the patient's home, right? And so I can do a urine test on a daily basis for all of these different diseases, right? And it can measure all of those aspects. We're used to things like, you know, the COVID tests in the home, but we're seeing a lot of these diagnostics for things like colon cancer or other things like viruses. And so, yeah, it's exciting that there are so many of these diagnostic labs that you can take yourself and that you can buy yourself. A lot of the time, you don't even need a doctor's orders.
Okay, fantastic. There are some questions about also, you've spoken a lot about also the care home within the context of the US settings, but also you gave us quite a bit of example in terms of technologies overall. Our guest is asking whether you see this playing out. How do you see this playing out in the context of other countries, in Europe, or maybe the UK? But what's your experience from other countries?
So while it may be a slightly slower start because they're mostly government sponsored, right? Whereas here in the United States, a lot of our $4 trillion healthcare system is managed and run by private corporations, right? So private corporations are going to move much faster than, say, government sponsored things typically. And so as we move more and more care into the United States, and we're getting that hardcore data back, not subjective data, we're getting objective data back. The writing's on the wall at that point, right? When you start seeing like cost reductions, you start seeing saving lives, increased patients' lives. It's really just showing them the proof, right? But I'm also seeing other companies, other countries like the Nordics. The Nordics are so far along on value-based healthcare that they put the US to shame, right? And we're really trying to work on VBHC, but the Nordics have it down, right? And so there are certain things that countries in Europe and countries in Asia are able to do even much better than the United States with their smaller healthcare systems.
And I think from what I hear is also about, you mentioned Scandinavia, is also about how digital savvy a country is, right? And so I think this is also really connecting. So we have a question that is really down this line, which is about if you are thinking about then having access for patients, and I'm thinking about countries that are more digitally savvy, what about elder people? How do we reduce the digital gap between these low digital skills people and the telemedicine technology?
Oh, it's so exciting. So there are a number of devices really just aimed at aging in place and making things as easy as possible. So you don't have to like try and program a VCR, which I still cannot do myself, right? Like getting the time clock on it. So one of the cool companies is Intuition Robotics, and they've got a product called the LEQ. The LEQ is a smart tablet, a smart speaker, and a video camera all in one. And it's, nicely aesthetically designed, similar to an Amazon Alexa. And it is specifically for aging in place. And so a senior doesn't need to type anything in. They can just say, hey, LEQ, call my doctor, or hey, LEQ, call my son. It can do things like medication reminders. It can do exercise reminders. It can do education. And because the LEQ is actually based in machine learning, it learns about the patient over time. And so it may notice with their video camera that grandma walks past LEQ every day at 9 a.m. to go get a cup of tea in the kitchen. And if grandma suddenly doesn't show up one day and walk past LEQ, LEQ is going to get worried, right? And it's going to ping grandma, ping, say, her son or her contact. And then while it can't do emergencies like 911 here in this country because it doesn't have authorization, of course, you can see that leap that they could do 911 if they wanted to. And in fact, CVS, which is one of our biggest healthcare organizations here in the United States, it's a private payer, a pharmacy, and a provider. They launched the CVS Symphony about 2 or 3 years ago. And what this is a smart speaker for aging in place. And that one does actually call emergency services. And so the patient or the senior aging in place can do all of its interactions using voice technology, and it will keep an eye on them. And both of these companies can do things like fall detection as well.
So I love the example. As I read the question, I was actually thinking about my elderly parents, and then what you said about voice, it just reminded me of my dad speaking to Alexa. So I really love the example, and I think this is something that really companies can utilize also for people that are maybe a little bit older and so less digitally savvy.
Yes.
I think we're on time, and so we're not going to be able to take any more questions. Robin, I really want to thank you for this inspiring talk and really sharing with us transparently your experience, your personal experience, and also how you see the market developing. It's been an absolute pleasure to have you here. And for everybody online, also absolute pleasure to have been able to answer your questions and have this live Q&A. Now, I want to remind you that there is also a QR code that you can scan, so you can give us feedback. This webinar and these live sessions are really is really important for us to receive feedback, so we can cater for the next sessions. And then, yes, I hope you enjoyed the webinar today. It was fantastic for me to be here. Thanks again to Robin, and thank you for all the participants on the line. For wherever you are, have a good morning, evening, or afternoon. Take care.